Why are cancer rates, particularly for colon cancer, rising? Not just among the older population, but increasingly in younger people as well. Today, let's explore this concerning trend and provoke a meaningful debate. Make sure to watch until the end because there's a list of the most common colon cancer symptoms that you might be experiencing. But first, subscribe our channel for more health-related content. Colon cancer ranks as one of the most devastating diseases today. It is the third most commonly diagnosed and the second most fatal type of cancer. But what makes the fight against this disease even more complex is the formidable industry that has been built around it. An industry driven by money, misleading ads, and so much confusing information that it leaves both patients and healthcare professionals puzzled and often wrong. A common misconception is that your risk for colon cancer is primarily determined by your genetics. While it's true that having a family history can increase your risk, accounting for 5 to 10% of cases, this is far from the complete picture. Genes may load the gun, but it's our lifestyle choices that pull the trigger. In this context, modern research is increasingly highlighting the impact of diet and lifestyle as key factors in preventing or even reversing the disease. How to know if you have colon cancer? What are the early symptoms of colon cancer? What symptoms indicate advanced stages of the disease? How can you detect it early? What exactly is a colonoscopy, and who should consider having one? What are intestinal polyps? And how can they be prevented from turning into cancer? Contrary to what many believe, this type of cancer often eludes detection for a long time, sometimes years. It typically starts as a small, slowly growing polyp on our intestinal wall. Initially, it occupies minimal space and doesn't interfere with the intestine's contents, which is why it doesn't produce symptoms in the early stages. Therefore, those at higher risk, especially individuals over 45 or 50, are advised to undergo a colonoscopy. The recommendation comes even earlier if you have first-degree relatives who have had cancer. The appearance of symptoms often depends on both the size and location of the tumor. Interestingly, colon cancer growing on the right side of the intestine can be more elusive. This is because the feces are still liquid at this stage. The intestine hasn't absorbed all the passing water yet. As a result, it's difficult for a tumor to obstruct the intestine at this point unless it is very advanced or has metastasized to other organs like the liver, bones, or lungs. Tumors often grow in a disorganized way, causing them to bleed. The issue is that this bleeding is not visible. One early detection method involves analyzing stool samples for hidden blood. Chronic bleeding can result in iron deficiency anemia. If you're around 45 or 50 years old and look paler than usual, coupled with iron deficiency anemia, you should be evaluated for an intestinal tumor. Now let's consider colon cancer that occurs on the left side of the intestine. Obstructions or intestinal occlusions happen earlier here because the feces are already solid. There's less water compared to the right side. What symptoms might a person experience before we further explore the following colon cancer symptoms? Don't forget to subscribe to our channel and activate notifications to stay updated with our informative videos. One common symptom is a change in bowel habits. If your normal routine involves going to the bathroom daily or once every 2 or 3 days, and you find yourself becoming more constipated recently, not having bowel movements for 1 or 2 weeks, this should raise suspicion. Alternatively, you could experience episodes of diarrhea alternating with periods of constipation. Many people experience chronic diarrhea, prompting doctors to consider performing a colonoscopy to check for the presence of an intestinal tumor. When the tumor grows to an advanced stage, it produces an image on an X-ray resembling a bitten apple. Specifically, this image shows the narrowing of the intestinal lumen due to the tumor. Other symptoms indicative of more advanced cancer include abdominal pain from obstruction-induced gas buildup, abdominal swelling, weight loss, fatigue, and chronic tiredness. Symptoms could also manifest in internal organs, such as liver pain from metastasis or shortness of breath if the lungs are affected. That's why the next information on how to detect this condition early and, most importantly, how to prevent it naturally is crucial. What are intestinal polyps? These are generally benign small tumors that hang like appendages from the wall of our intestine and are typically asymptomatic. The most effective way to detect them is through a colonoscopy. This procedure allows us not only to visualize the polyp but also to remove it and send it for lab analysis to determine if it's benign or malignant. What factors influence this transformation? As mentioned at the beginning, it's a combination of our genetic makeup and our lifestyle habits. Contrary to previous beliefs, our genes are not set in stone. The best way to prevent colon cancer. Current research suggests that our dietary choices, from the selection of food at the supermarket to its preparation, play a critical role in our health. A balanced diet, along with other healthy lifestyle habits, can actually influence gene expression. Specifically genes associated with chronic inflammation, dementia, obesity, heart attacks, and cancer. Risk factors for colon cancer include several factors that contribute to the transformation of a polyp into cancer, such as ultra-processed foods, excessive red meats, bad fats, excessive vegetable oils, sugar, excessive sodium, constipation, poor or inadequate intestinal flora, microbiota, and chronic inflammation. Furthermore, habits like alcohol consumption and smoking are also known to be carcinogenic. Foods and habits to prevent colon cancer. To reduce the risk of colon cancer, it is advisable to maintain a diet rich in anti-inflammatory and antioxidant foods. Now, let's talk about diverticular and diverticulitis. You may wonder if you can consume seeds, nuts, and the hard outer coatings of some seeds and nuts if you have these conditions. The answer is yes. A comprehensive study found that consuming these foods does not increase the risk of diverticulitis or its complications, such as bleeding. As a result, it is no longer recommended for patients with diverticulitis to avoid these foods. However, each case should be individually evaluated, so if you have any intestinal issues, consult your doctor. Colonoscopy. What is it, and who should get one? A colonoscopy is a medical procedure designed for the early detection of colon cancer. It is generally recommended for all individuals to start undergoing colonoscopies at age 45 or 50. The frequency of subsequent procedures is usually every 10 years unless your doctor advises otherwise. While the procedure is considered safe, there are some risks, such as bleeding or injury to the intestinal wall. We hope you found this video helpful. If you have something to add, please share it with us in the comments section. Give this video a thumbs up and share the link with your family and best friends so they also know the critical colon cancer symptoms that cannot be ignored. If you're new to our channel, don't forget to subscribe to support our growth and hit the notification bell so you don't miss out on our next video. Thank you for watching. Bye.